Unfortunately, a few days after Thanksgiving, we started seeing significant increases in new COVID cases and hospitalizations. This increase accelerated some troubling data trends and has put a significant strain on our healthcare community. In the 10 days before Thanksgiving, Massachusetts was averaging roughly 2,500 new positive cases a day, and that was included with a higher testing volume than we had seen previously. But after Thanksgiving, our numbers shot up, and the 7-day average on December 1st was about 2,444 cases, which would have been 4 or 5 days after Thanksgiving. And 8 days later, which would have been 13 days after Thanksgiving, that number had nearly doubled to almost 4,800 cases a day. That's a 96% increase in a little over a week. Similarly, prior to Thanksgiving, our positive test rate was pretty stable and had consistently been somewhere in the 2-3% range, under 4%. The current test rate, as most people know, is around 5.7%. Those combination of facts have translated into a significant increase in COVID-19 hospitalizations over the past 3 weeks, up by 93%. Patients in the ICU have increased by 73%, and patients intubated have increased by 104%. We've also seen deaths increase by 84% since Thanksgiving. 689 people have died in Massachusetts since Thanksgiving due to COVID. I don't need to tell anybody that these aren't just numbers. They're people and their stories and their relationships. Families have lost loved ones, people's lives have been shattered, and our hearts continue to go out to them. But the data points do speak to how COVID-19 moves. It doesn't stop. Many people have light or no symptoms at all, but at the same time, it can make others horribly ill. Roughly half the people in Massachusetts who get COVID never feel sick, never show any symptoms, but they can spread the virus again and again. Public health officials in our administration have warned folks for weeks to avoid large holiday gatherings heading into Thanksgiving, because when folks are at home with family or friends, they do tend to let their guard down. That's where the virus thrives, and over Thanksgiving in Massachusetts, it clearly did. More people are sick, our hospital system's feeling the strain, more people need hospital-level care, and healthcare workers are being pushed, once again, to their limits to take care of those with COVID and others. It's not a secret that we're in a second surge here in Massachusetts. And while hope is clearly right around the corner, arriving in dry ice in the form of a vaccine, it's not here yet. Getting through this period between now and when that vaccine is more available to people around the Commonwealth requires that we all do things that we know can stop the spread. Wearing masks, avoiding groups, staying within your immediate household, engaging in good hygiene. After seeing what happened in the aftermath of that one-day Thanksgiving, I don't think we should kid ourselves about the holidays in December. I'm pretty sure I'm stating the obvious here, but the holidays won't be the same as they've been before. Christmas, Hanukkah, Kwanzaa, New Year's Eve, they simply can't, and for most people, won't be the same. But I'm here today to say that we really can't have them be the kind of consequential event that Thanksgiving has been here in Massachusetts. We really do need the help of everybody to make sure that we don't have a repeat, so that our hospital system can continue to provide the critical medical care that it does so well for those who need it. And I can't emphasize enough that this is not forever. This is once, one time, 1 month, 1 year, where Christmas, Hanukkah, Kwanzaa, New Year's Eve really do and should be different. Next year, we'll probably be able to celebrate those holidays just like we used to, but not this year. Now, later today, DPH will release guidance on safe celebrations for the holidays. And Secretary Sutters will talk more about that in her remarks. But it's pretty simple. The safest way to celebrate this year is with members of your own household, and to postpone or cancel any travel plans, and to avoid gatherings with people you don't live with.